Hello and welcome to Laughlin Insurance LLC Medicare Basics video. My name is Tom Laughlin, owner and independent insurance broker. A little bit about me: I'm originally from Chicago, and yes, I'm a diehard Cub fans, but I will even help other fans of other teams, even the Cardinals. I'm a former executive chef for 20 years. And for the last 8 years, I've been helping people with their insurance needs. All of my clients know that if I'm awake, I'll answer my phone. I try to make myself very accessible to my clients because I know how confusing the various parts of Medicare can be. I made this short video to help explain what it is that needs to be done and when you need to do it done by. So please contact me with any questions you may have, but remember, I'm here to help you. This is an example of what your insurance card will look like. We'll have your name. Your number will be a combination of letters and numbers. It will have the hospital Part A effective date. It will have the Part B effective date. There is 4 parts to Medicare: A, B, C, and D. This is some of the services the different parts of Medicare provide. To be eligible for Medicare, people 65 years of age or older, or if you're under 65, you've been on Social Security disability for 24 months, or if you have end-stage renal disease. And this is who handles the Medicare. Now, applying for Medicare, you can apply 3 months before you turn 65, the month you turn 65, and 3 months after. You do not need to be retired. You just need to opt out of your group health insurance plan. If Part A and Part B start on different months, this requires a different time frame for signing up, so please contact me for more details. Part A is hospital insurance. For 2019, there is a $1,364 deductible per benefit period for hospitalization. Here's the copays for days 61 through 90 and 91 plus. And this is what some examples of what Part A covers. For Part A, if you've worked in this country legally for 10 years or for 40 quarters, your Part A premium is $0. If you worked less than that, you may pay up to $437 a month, depending upon your individual duration of Medicare covered employment. Part B is medical insurance. The standard monthly premium for Part B for 2019 is $135.50. Those with higher incomes may pay up to $460 a month for Part B. This is some of the services that Part B covers. Also, you pay the first $185 deductible yearly for Part B covered services or items. For original Medicare, after your deductible is met, you typically pay 20% of the approved amount of the service. There is no yearly limit for what you can pay out of pocket. Now, those not electing Part B when they're supposed to will incur a late enrollment penalty, and this is how they come to that dollar amount. Medicare Part C is an Advantage plan. These are offered by private insurance companies approved by Medicare. And this is what some of the services that they cover. There are different types of Medicare Advantage plans. They could be a choice of an HMO with a point of service, a PPO, or a private fee-for-service, or a special needs plan. Part D is prescription drug plan. This is the average premium for 2019 is $33.19. Some plans have a deductible. With an Advantage plan, you can get prescription drug coverage with it, and that is called an MAPD. There are 3 phases of the drug plans. The first is the initial coverage phase. During this time, it's a combination of what you spend and what the company spends totaled together until you reach that limit. And then once you reach that limit, you're in the coverage gap or donut hole where you personally spend $5,100. Once that's established, then you go into catastrophic coverage where these are your copays for the drugs during this stage of the drug plan. Also, some people may qualify for help paying for their prescription drugs. This is called low income subsidy. For example, here's the parameters for a single person. And here's the parameters for a married person living with a spouse and no other dependents. With LIS, you can get help paying your drug plan's monthly premium, yearly deductible, etc. And this is what the copays are for most drugs who qualify for the LIS. Now, signing up for Medicare, there are several different election periods. The initial coverage election period is 3 months before you turn 65 or eligible for Part A and B, the month you start A and B, or 3 months after. If Part A and B start on different dates, this requires a different time frame for signing up, so please contact me for more details. Also, something new for 2019, CMS is restoring the Medicare Advantage open enrollment period. This takes place from January 1st to March 31st, and this will allow you, if you're enrolled in a Medicare Advantage plan, you can make a one-time election to switch to another plan. Here's some more examples of what you can or cannot do during this time frame. There are also special election periods. Here's examples of just a few. Here's some more examples. So if you qualify for any of these examples, you can switch or sign up for a plan at any time with this. Some questions that you would need to ask to make sure you're joining the right plan for you. The provider network, hospitals, etc. What changes, positive, negative, that may impact your health care. Also, some other items to keep in mind: the size of their network, what are the copays, and extra benefits like dental, vision, or hearing. Here's the phone number for Medicare. Also, the phone number for Social Security is 1-800-772-1213. There's the website for Medicare.gov. Laughlin Insurance is your one-stop shop for Medicare and Medicaid information. These are all the plans that I represent and some of the other services that I can help you with. I will provide you with all the facts necessary to make an informed decision. I represent most of the major Medicare Advantage and supplement plans in Florida. I work for you, not the insurance companies. There's no cost or obligation for any of my services to you. I can meet you at your home. I have an office on Cimarron and Colonial Drive, or we can meet at a Dunkin' Donuts or a Panera Bread. I want to thank you and have a blessed day.